Are you turning 65 soon? Getting ready to go on Medicare? Are you starting to get lots of things coming in your mail soliciting you for Medicare plans? Are you getting phone calls? Be really careful with those. And in some cases, are you even having agents showing up at your house, knocking on your door, trying to sell you Medicare? If so, you're going to want to listen up because today I'm going to go over 9 things you probably should know about when it comes to getting on Medicare at 65. Hi, I'm Chris Prang. I'm a licensed insurance agent based out of Charlottesville, Virginia. I'm also licensed in other states, and you'll see that list towards the end of the video. So let's go through these 9 things. Number 1, I've just alluded to. At about 64 and a half, you're going to start getting mail soliciting you for Medicare and for life insurance. Be very, very careful. You may get something actually from the Social Security Administration and from Medicare. Okay, so make sure you pay attention to what you are receiving. A lot of people will send you stuff that looks like it's official government, and it's not official government at all. Be careful of the phone calls for sure. People will call up and say, we're with Medicare, or we're calling on behalf of Medicare or Social Security, and you need to get a plan. And the next thing you know, you're enrolled in something you didn't want to enroll in. So by no means, do not speak to those people, and certainly do not give out your Social Security number or your Medicare card. If you call me, I have no need initially for your Social Security number or Medicare card to go over all the plans. It only comes to when you have to enroll that I would need your Medicare ID. So be very, very careful with those things. Number 2, make sure that you are signed up for Part B at least 3 months before you need your Part B to start, which was for most people, it's going to be at age 65. If you're going to keep working and you have good group insurance and it's more affordable to stay on the group insurance, then you don't need to take Part B. If you have questions about that, by all means, reach out to me and we can go over that. But otherwise, you're going to want to make sure that you get your Part B signed up for at least 3 months before you're 65. You could get a card in the mail with already Part A and Part B, and if you do, you're set. You're ready to go. But if you don't have one by the time you're about 3 months out from 65, then you need to either go on to the Social Security Administration website, which is ssa.gov, not .com, not .org, or not .net. So be careful, ssa.gov, or go to your local Social Security Administration and talk to them and get enrolled into your Part B. And usually within anywhere from about 10 to 30 days, you'll have a card in the mail. Number 3, if you have an HSA, you need to stop contributing to that HSA before your Medicare starts. You may want to check with your CPA. If you look in the Medicare New Book, it tells you under the health savings account information, you aren't eligible to make contributions to an HSA after you have Medicare. To avoid a tax penalty, you should make your last HSA contribution the month before your Part A coverage begins, and then it has other information in there. So if you have an HSA, be careful. Number 4, you can't or you should not keep your major medical plan or your marketplace plan. I'm not talking about retiree insurance or group. I'm talking about an individual major medical plan or a marketplace plan. Now, usually these companies will send you some notification a month or so out telling you that your plan is going to terminate at the end of the month when you're getting ready to turn 65. If you do not get a notice like that, then you need to reach out to them once your Medicare is all set up and have your marketplace or your individual major medical plan terminated. If you look again at the Medicare New Book, it says once you're considered eligible for Part A or you already have it, you won't qualify for help from the marketplace to pay your marketplace plan premiums or other medical costs. If you continue to get help paying for your marketplace plan premiums after you have Medicare, you may have to pay back some or all of the help you got when you file your federal income taxes. So if you're definitely on a marketplace plan, be careful. Make sure it terminates when your Part B starts. Number 5, your healthcare premiums and out-of-pocket costs more than likely will go down. Happy birthday for turning 65. Almost everything goes up. In this case, more than likely, your premiums and your out-of-pocket costs are going to go down. But we can always do a comparison to make sure that that is going to be the case. Number 6, when you turn 65 or you first get your Medicare Part B, you have up to 6 months after you turn 65 or after your Part B starts to have a guaranteed issue into a Medicare supplement policy. And this is very, very important because after 65 and a half or after 6 months of your Part B starting, you do not have a guaranteed issue. So if you have serious health issues and you really wanted or really needed a Medicare supplement policy, more than likely you're not going to be able to get one unless you live in certain states at certain times of the year or under very special circumstances, which I could explain more so over the phone or in person. Another reason why this is important, if you're turning 65 and you currently have some very serious health conditions, maybe you're battling cancer, kidney failure, early onset Alzheimer's, Parkinson's, things like that, things that may precipitate you needing to go to the doctor and the hospital a lot, then my advice is you strongly consider a Medicare supplement plan. Now, in certain areas, the Medicare Advantage plans are very, very good and are going to be more affordable as long as you understand how they work. But that's one of the things that we go over. So you need to be very careful when you're turning 65. If you have health issues, then you need to seriously consider a Medicare supplement. And you have that guaranteed till you're 65 and a half or 6 months after your Part B starts. Number 7, if you are on Medicaid before 65, you need to find out if you're going to still be on Medicaid after 65. If so, you are going to be called what's a dual eligible, someone that is eligible for both Medicare and Medicaid. If so, then Medicaid is going to pick up your Medicare Part B premium, and it may pick up your copayments. The reason why this matters, what level of Medicaid you have, is it may depend on what type of other insurance you get. Is it a supplement? Is it Medicare Advantage? So you need to find that out. Number 8, very important that very few people do, it's get your affairs in order. If you have not done this already, and I have found after almost 13 years and several thousand people that most people have not at the age of 65. They do not have a power of attorney. They do not have a will. They do not have a living will, and they may not have a trust. Now, not everybody needs a trust, but some people do. But everybody probably should have a power of attorney and a will and a living will. If you don't have one, then you need to contact an estate attorney in your area that can draft those up for you and get those taken care of. If you happen to live in the Central Virginia region and would like a recommendation, then reach out to me and I will give you the name of somebody that I would recommend. So you want to get your affairs in order. It's important because down the road, if somebody needs to make a medical decision for you because you can't, then you need to have the power of attorney to do that. Number 9 thing that you should know is contact me about 2 to 4 months before you go on to Medicare. You're welcome to reach out to me beforehand if you have questions of getting the stuff signed up, by all means. But when it's time to enroll in your plan, contact me about 2 to 4 months before you turn 65 and you get your free Medicare review. We will go over everything, all of your options, supplements, drug plans, Medicare Advantage plans, whatever is best for you. We will determine the lowest overall cost for your prescription plan as well. If you have questions, if you need help, go to my website, themedicareanalyst.com. There's a contact page on there that you can reach out to me. There's lots of information over a lot of the stuff that I just went through on there. You can check that out. You can call me on the number that you see there. It is a recorded line. It will tell you it's a recorded line, and you can schedule appointments. States I'm currently licensed in: Virginia, North Carolina, South Carolina, Florida, and Tennessee, with more states coming. You can help me out by simply putting in the comment section below what state you are watching from. And then as I see where people are watching from, I will start getting licensed in those states. You can also do me a favor and click the like button and click the subscribe button. And lastly, if you have a question, comment, suggestion, put it down in the comment section and I will try to get back to you or answer it in a video. So that's it for today. 9 things you probably should seriously consider when turning 65 and going on Medicare. Thanks a lot and make it a great day.